we sort of talked about flu and we sort of talked about COVID. We didn't talk about the other vaccines that are available on the market today and how really we shouldn't be talking about a vaccine anymore. So for instance, we don't call them flu clinics anymore because a flu clinic implies you're giving a flu shot. We call them vaccine clinics because we believe that if someone is getting a vaccine, there's definitely at least 1, 2, 3, or maybe even 4 other vaccines they're eligible for at that time. And so I think it's important for us. You kind of asked, like, how do we get started? I'm hoping there's some people on this call that have already started. And so for those that have already started, how do we level up? How do we get to that next point in our profession where we're really rising to the top of our license? We are going in now because we're going to be giving you all of your vaccines. So, hey, I see you signed up. Well, here's what we do. So we do vaccine care plans. So if somebody says, I want to get a flu shot or I want to set up a clinic for flu, we say, great. We get all the patient information. We run them through our state IIS system, a state registry, and we see what vaccines they're eligible for. And then we go back to them and say, okay, so we got your clinic coming up. All these patients are going to get their flu shot. All these patients are going to get their pneumonia shot. All these patients are going to get their RSV. And, can you just please make sure that we have enough time and space to do all that? And they're like, oh, okay. And I picked that up, Francis, from a pediatrician who said to me, I don't ask my patients what vaccines they want. I tell them what vaccines they're going to get. So it's the difference between like an opt-in and an opt-out program, right? An opt-in program is, Francis, do you want dessert?
Almost always.
Okay. Do you want an opt-out program is, do you want chocolate cake or do you want cheesecake, right? So you have to say, no, I don't want dessert, right? So an opt-out program, I assume you're going to have dessert, right? I assume you're going to get the vaccines that I recommend because I'm a pharmacist and because I've done my job, right? I'm not going to recommend something that's not appropriate for you. I'm not going to give you something you've already gotten, right? I'm going to use decades of experience and history we have in our profession to say, these are the vaccines you're eligible for and that are recommended for you, and these are the ones that we're going to give.
Super interesting. Yeah. So that is absolutely a way of, hey, if you've started, how do you expand what you're doing? How do you kind of level up the amount of service that you're providing?
And for anybody that's nodding right now at that idea, it's the easiest year it'll ever be. Because for everybody 60 and over, we can give them 3 shots without even looking at anything. Because there's no way they got the COVID vaccine yet. There's no way they got RSV, and it's this year's flu shot. So you don't even have to do all the work that I just did. You can just start with those 3 and say, hey, we're coming out for your COVID clinic. We're bringing flu and RSV with us as well. And everyone's going to get all 3, right? You don't even have to worry about it. And you might get 1 or 2 people that are like, oh, so-and-so got picked up by her daughter and they got their COVID vaccine yesterday. Okay, great. Well, then they won't get that one. But those 3 we can give to everybody starting right now.
Right. That's great. Are there other ones? So do you do your clinics specifically for the population of patients that you serve on a regular long-term care basis?
We do.
Do you do any others in the community?
Anybody who asks.
Anybody.
So we've done schools, we've done businesses. We have a really cool partnership right now. So ASCP, the American Society of Consultant Pharmacists, you might know Chad War, is just partnered with USA Boxing. And so we are going to boxing events and we are vaccinating at boxing events.
Right?
I mean, it's just wonderful. And that's the other thing that's fun. Like, if you're wondering, like, you asked, how do we start? If you're wondering what the other side looks like, the other side looks like everything that comes our way, we can pretty much say yes to. Especially in Illinois, we're fortunate that techs can give vaccines. So as long as I have a pharmacist available to go, our techs can do the registration, they can give the vaccines, they can do the setup, the cleanup, pharmacists there to answer questions or vaccinate as well if they want to. But we have got a program now that you just tell me when, where, and how many, and we can kind of handle it from there.
That's fantastic.